Welcome to Southern Health Podcasts, conversations with perinatal psychology, talking about maternal mental health because your mental health matters for you and your children. I'm Samantha Dyer-French.
And I'm Aileen Chick.
And we're peer support workers for the Maternity Mental Health Service. This week is Maternal Mental Health Awareness Week, and the theme is Rediscovering You. Today's focus is Perinatal Positivity Pot, shining a light on parent voices and recovery stories. So we're going to be talking with Fari and Susan, who, like us, have also used the service. So it's probably a good idea to introduce ourselves.
Yeah, so hi, I'm Aileen. I went through the service and the Maternity Mental Health service in 2020, following a history of traumatic labour with my son and then a traumatic miscarriage, both resulting in PTSD and anxiety. Over to you, Sam.
Okay, so I am Sam. I was referred to the service in 2019, 2020 with my daughter. And that was because I have very intense phobias of needles and blood and medical interventions. And then subsequently, birth trauma with my daughter. So I kind of went through the service perinatally, antenatally, and postnatally. I'm going to throw it to Fari next.
Hi, everyone. I'm Fari, and I was referred to the service in 2021-22 because I had a really difficult pregnancy, and yeah, it was affecting my mental health.
And Susan.
Hi, I'm Susan. I was referred to the service in 2019 and went through it for about 18 months. I had a difficult birth with my son. He was also neonatal for a week and suffered with PTSD and anxiety as well, so was referred to the service.
Okay, so plethora of experience. And it's quite nice that we've all kind of around the same time as well, I think, kind of going through the service as well, those couple of years sort of thing.
Yeah.
So like I said, the day is the perinatal positivity pot, but the week in general is rediscovering you. So Aileen, did you want to maybe start us off?
Yeah, so in that on that theme of rediscovering you, what does that mean to you in the context of your recovery?
I think that's such an interesting question because I've been thinking a lot about how you're never, after you have a baby, you're never going to be the same. Like, I think I had this idea that I'll have this baby, then it's going to be traumatic, but then I'll get back to myself. It's going to be fine. I'll get back to the old Fari. But the truth is, you don't, like, you're just a completely different person. So I think for me, rediscovering me was just accepting that I'm never going to be the same. And I need to accept that this is who I am now. And that's okay. Like, it's not going to be the same person. And it's not a bad thing. Like, I'm Fari 2.0. Like, I'm better. I'm a better version. Because I've been through a lot and I've come through it. So I think if you think about it that way, it's actually a good thing because you can go through hard things, you can do hard things. So that means you're actually a better version of you.
Yeah, I completely agree. I was thinking about this earlier, and for me, I'm a completely different person from pre-kids to having a child, and then completely different person from having the trauma in between the two kids. Completely different mum between, like, to each child. And I used to judge myself a lot on that, like thinking, am I raising my two children differently? Is this fair on the first one? And things like that. And I thought, well, actually, I think it's made me more understanding. It's made me, I've grown as a mum in general because you do as you go through your journey. But I think it's made me grow as a person as well, in the sense of I'm more compassionate then, and I understand, like, the toddler mind and the young person mind a lot better. And I think it's what you said, it's just about accepting that you are going to be different. Of course you're going to be different. It's having children is life-changing, and that's okay. And that took me a long time to realize that, but it is okay.
Yeah, I think for me, I feel like I've kind of come into my own, if that makes sense. Like I always wanted to be a mum, but it wasn't like, oh, I've got this huge maternal instinct, I have to have children straight away. I mean, I was 34 when I had, my daughter, so it's not like I was like, that was all I could think about. But I really feel more myself, if that makes sense. So I feel like I've actually not even like rediscovered, but just kind of discovered, yeah, like who I am, I suppose, who I'm supposed to be. It feels very natural to me, and I know that that's not the case for a lot of people, and like, but even just people that are very close to me, that's not the case, and it is very much a way of finding themselves again in amongst motherhood. Do you know what I mean? But for me personally, I actually really love it and love being a mum, and I find that that is something I really enjoy, but also I hope do well in. So that's what I've kind of discovered as such. Yeah.
I think learning how strong you are as well. So if things don't go how you want them to, not seeing it as a failure, as was one of my problems, but realizing that you did what you had to do, you got through it, and you will continue to get through it, and you just keep going and look at it as strength rather than anything else. And I think that keeps you going as well.
Yeah,
I think that's a really good point, and kind of brings me nicely onto what I was thinking next was, what were those breakthrough moments or those key milestones when you realized you were on the path to recovery or discovery in that case?
For me, it was when I went through the service, I started out with the statement I had failed, because that's what I'd felt. Nothing had gone to plan for the birth. My son was very poorly. But through this service, I managed to change that to I am strong, and realizing that what I had gone through, I did it. I didn't question it. I got on and I did it, as hard as it was. And realizing that I am strong, and not just, but the service helped me with previous things that I'd been through as well. So it just kept me going, and doing these grey groups and this podcast has reminded me that I need to keep saying I am strong, and focusing on that.
Yeah, I really like that, and I've got a few bits to read out from another member that's been through the service and wanted to join us. And you've just kind of echoed what she said here. I'll read it out. After a few months, a little bit of adjustment time to becoming a parent and recovery from a traumatic labour, becoming a mother felt like the most natural thing in the world. I just needed time and to remind myself that I could do this.
Mm.
And I think that's really powerful, isn't it?
Yeah, it really is. I think for me, like it's that those breakthrough moments of like especially like antenatally, were the actual blood tests that I managed to have. So I went like my whole life basically from, I think it was from age 6 until 34, of not having an injection, a blood test, anything like that. I went through the, not doing it, avoiding it. It was a real like issue for me. And to have that first blood test where I didn't fit and faint, that was a huge breakthrough moment. It was like eureka, kind of like, what is this? What is this life where I don't have a fit, kind of thing? And it was huge. And just having that to reflect back on in like my sessions with my psychologist, just meant that I had something like tangible, rather than it just being an idea of like, oh, well, you might not, we can put all these things in place so that you don't. But actually, all my experience before that was, yes, you will, So to have that moment of when I didn't was a huge moment for me.
I think while I was going through the service, my psychologist, because I was obviously you're going through the pits. So then I was very negative, everything. My son was also in NICU, and he was in NICU for 3 months. So and he came home on oxygen, and it was obviously that horrific, absolutely awful. And then I was starting to feel better, and I was saying to my psychologist, she was encouraging me to like maybe take him out. And I was like, okay, I'm just gonna drive. There's like a shopping center like 5 minutes drive away. And I was like, I'm just gonna drive him there, and then we're gonna pop into Maternal, and it's gonna be great, right? It was horrendous. He was 3 months at this point, but he was still pretty much a newborn because he came 3 months early. Um, and he just did not like it. He didn't like it. He's always been determined, even in my tummy, but like he'd just chuck his dummy on the floor. Then I didn't have another dummy, so then his dummy was dirty. And then I got tangled in his oxygen tubing. It was awful. I was just like, oh my goodness. And he was screaming his little lungs out. And then so then I was like, I give up. So I took him back into the car. And I just sat there and I cried and cried. And then in my next appointment, I was telling my psychologist, and I was like, it was horrendous. I will never take him out ever again, blah, blah, blah. And she was like, okay, let's think about the things that went right. And I was like, okay. And she was like, let's think about all the things that you did right. Like, first of all, you got in a car and you drove your child. You thought you'd never do that. So, like, she would make me look at things that I would automatically think as negative, like, look at all this negativity. And then she would be like, okay, let's calm down and let's think about all the things you did right. And then she'd talk about what things triggered you. Okay, are they things that we can avoid? That sort of thing. And like I'm still doing it now. Like sometimes I feel like I've had the worst day, I'm the worst mom, and blah blah blah. And then I just sit down and I'm like, okay, Fari, let's think about what did you do right? Let's think about what triggered you. Can we avoid those triggers next time? You know what I mean? So I think a breakthrough would probably be learning those skills, because I think sometimes there's this thing of like having this kind of support will fix you. But the truth is life is going to continue to life. But I think the good thing about this service is it gave me the tools to deal with life and be like, okay, it's going to be hard, but how am I going to like progress and not like wallow in the negativity? So I always feel equipped now, even though life is still difficult and we still have lots of appointments and sometimes it can be really overwhelming, but I feel equipped. And I think for someone who is perhaps at the beginning stage of this process or is waiting to get on it, I think that's a realistic expectation to have, that it may not fix you exactly, but it will equip you to be able to deal with what life will throw at you as a mom.
I 100% agree. I think one of the points we were going to get to was about like how do you feel, or how do you know that you're going to be near the end of treatment, and how do you feel when that moment comes? And I think what you've said about having those tools and actually acknowledging and accepting that it's not a fix. You're never going to be fixed. Like I know that with like my phobias, that's so ingrained in me, so much a part of what was my personality. Do you know what I mean? Like that's what I knew myself to be, that I knew even with 2 years or whatever it was of psychology appointments and giving tools and everything, I knew I was never going to be like, yay, take my blood, yeah, prod me with a needle. Like I knew that was never going to happen. But what it has done is exactly what you've said, is it's given you those tools to know that actually I got through it before, I can get through it again. What were the things that helped me when it went right? What were the things that hurt me when it didn't? And actually learning from those things. And sometimes you can't do that on your own. Like you can't, when you're in the midst of it, you can't see the wood for the trees and all of that. You actually sometimes need someone to sit you down and ask the correct questions at the right time. And yeah, I don't know, I mean, I can see you nodding, but like I feel that that's exactly what our psychologists do, is that they know the right questions to ask to make you find the answer yourself.
I think that's a really important point to raise, that this isn't necessarily, when you've had a trauma, when you've been through a lot, having therapy is not to necessarily fix you, but to like this theme of the week is about, is to rediscover you. And that may be to rediscover the new you, and you are fixed in a different way as such. I mean, I remember when I was come towards the end of my treatment, like I'd progressed so far. It was the differences between pre and post were enormous. And for me, my trauma had sent me so far down that I wasn't even functioning as a human being. Like basic life skills had just been completely forgotten. So to be back to some form of me, as much as the trauma is always going to be there and I'm always going to have my struggles and my triggers and things like that, I was able to function as a person again. And when you've got children, that's kind of important. Everyone's nodding at me. It was a big thing, and I was able to get through the labour with my daughter with as minimal trauma to me as possible. And silly things, it won't sound a lot to other people, but my trauma was in my bathroom, so I was able to use my bathroom again, kind of an important room in the house, and to be able to bath my child again. That was it. It doesn't sound like, I mean, for most of us it's a chore, and I certainly now think it's a chore, but to be able to do that in that moment was amazing. But yes,
I think
it's
for me, when I was nearing the end of treatment and my psychologist was kind of, like tentatively, oh, by the way, probably only got a few sessions there. And then I did feel quite anxious about it, even though I'd come so far. I definitely still felt anxious about that having that support cut off, as it were. I mean, they're really good in that there is a transition kind of thing. They do it well. And you kind of like reduce the amount, and then you come back and then have a little evaluation and all of that. But I just remember thinking, well, what if I can only do this when I've got that support? What if I can only go for a blood test when I know that I can talk about it with my psychologist and have these different tools to hand with her reminding me and things like that. So there was that element of anxiety about it. But I've been out of treatment now probably as long as I was in it. And I did manage to have a blood test as well, like post that. I haven't had one for a while because I haven't needed one. And I'm not going to say that I'm not a bit anxious about the next time I'm going to have one. But like Fari was saying earlier, when you know you have got the tools that you can then look back on, it does give you a bit more confidence in yourself. Like you trust yourself a bit more, which I suppose is what you were saying as well, Aileen, about kind of understanding yourself a bit better.
I agree with that. And Sam, you're in good company because I have a severe needlephobia and unfortunately have to have a lot of blood tests. So it's not great. But from this, I managed to learn how to cope with them as well and learn to ask for help. I know I have to have someone with me. And when I come out, I say, didn't I do well? Rather than worrying that I completely freaked out and burst into tears or whatever. But when I came to the end of my treatment, I'd have to say with the service, I never felt rushed. I knew that I was there until I needed the support. It was absolutely fantastic. And I know the whole point is to sort of recommend and get the word out there. So do it. If you however you need to, then do it. And it's there for you. And I was anxious coming to the end, going without that support. But part of me was excited. I had the tools. I was ready to go out and see if I could use them. I was at that point, which suffering with anxiety and that anyway was a really big step to try and do this by myself. But I knew the support was there if I needed it. So I knew I was ready to try them out and to see how I got on, I think. So yeah, it's about the tools. You're never going to fix. And I think you need those tools and you keep using them.
Yeah, so. Definitely. Yeah. If you don't, you know that you can return back and kind of just refresh yourself as such.
And I think on the note of this being the perinatal positivity pot, I love that you can come out of your appointments and go, didn't I do well?
Yeah.
I do fantastic, instead of focusing on the negative. And I think that's great. Like we've all come so far from where we were to where we are now, to be able to, like you say, yes, be anxious, yes, be nervous. Those feelings don't go away, but to be able to come out of it and see the positive side of things, like Fari was saying, her psychologist was teaching her, like, what went right about today. Let's not focus on the negatives, let's focus on the positives. And I think that's it. It can be difficult to do, definitely, but I think once you've kind of got those tools, like you say,
I think there's a line of toxic positivity, you know, of like just only thinking about the positive. Because actually, I think what we've all learned is to acknowledge the negative, or kind of understand the triggers, or you know, things like that, because then you're able to shift your focus to the positive. I think that's probably quite key as well. And or balancing it, like recognizing that there are both, you know, because when you're like Fari was saying, like all you could think of was it went terribly and you were never going to do it again, but actually having a shift in your focus to try and balance it out of like, okay, that bit went wrong, but what bit went right? It's the balance, isn't it? And I think that's the thing that stops you spiraling, probably.
yeah.
Learning to acknowledge the negative. Don't ignore it. I made that mistake when suffering with PTSD. I was like, I'll just ignore it. It will go away. And obviously it didn't. So by acknowledging it and knowing what it was, understanding that it was completely understandable from what I'd been through, it was my journey, didn't matter how other people had gone through and coped, that didn't matter. That's what I was dealing with, and learning how to deal with it, and knowing, okay, this isn't going to last forever, and here are the tools to deal with it, but not ignoring it, because that doesn't help. But also those tools, they work with everything in life. So they helped me with the birth that I went through, recovery afterwards. But even my son's 5 now, and even now it helps me with day-to-day life, especially that failure into strong. You know, it helps with everything. It's not a service that will just specifically focus on that. It helped me with everything. And even if like you go in and you realize that there's a lot more than you were expecting, you thought, okay, it's just this bit and there's a lot more, those tools will help you. I like the analogy. I had a box. The box was all messy, no organization, and the service helped me empty that box, shine a light on it, and put it back in a nice order that I was in control of. The negatives are still there, they will be, but they don't define me, and I'm in control of them now. But those tools, like we were saying, is what helps me manage that.
That leads us really nicely onto like our last point to talk about as well, actually.
Does.
What do you feel are the main differences between who you are now, like post-treatment, you know, like you were saying with your nice kind of organized box, to who you were before you started treatment? Do you think there's a huge difference, or is it just a change in mindset, or like?
For me, it's a change in mindset, but that is a huge difference.
Oh,
so
yeah.
One thing I did learn was about perfectionism. I'm a failed perfectionist. Everything has to be perfect, but that's impossible. So I know I'm not perfect, but I always strive for perfection, which didn't help. And now I was taught through the service, just make it good enough. And that has changed my life in every way possible. I do have to remind myself, you know, that the housework's not going to be perfect. Yes, my son hasn't got his shoes on. I've asked him 17 times and I'm turning into a Batman voice, you know. But it's good enough. We got out he's got his shoes on, mostly on the right feet, but we got out the door, for instance. The house, it's livable. But yeah, I think for me that was, so it sounds like a small thing, but for me that was, I'm a different person now because of that.
Yeah, I think that's so important to know, and making me think about the story that I've got here from another member that wanted to join us, like I mentioned earlier. She was saying that having the team, having the service, having that empathy and that genuineness and being treated like a normal person has empowered her and gave her the courage to get to where she needed. And I think that's the bit, isn't it? Being empowered to know that it's okay if it's not perfect. It's okay if something doesn't quite go right. And yeah, I think, like you say, it's maybe just more of a shift in mindset to anything else.
I think I agree with Susan in terms of it. It seems small because it's a change in mindset, but then it changes everything. So I think I'm different in that respect. I think, to be honest, when I was referred to the service, I was just kind of like, oh, I don't think I really need it. Like, oh, I was very like skeptical about it. I was like, oh, what's it gonna do? And my husband is actually a mental health nurse, so he's the one who would like keep my appointments in his diary so that he could keep reminding me because I was just like, I'm too unwell for this. I can't be bothered. And he was like, nope, today you have an appointment. You need to get up, you need to get dressed, blah, blah, blah. And I feel like if he hadn't insisted and pushed me, I don't know how I would have coped, to be honest, because I wouldn't have the tools I needed because my doctors thought that after the baby comes, everything's going to be better because, the baby will be out and you can start to feel better. But then I didn't, like I just kept getting worse and worse. So I really don't think I would have coped if if I hadn't had someone to speak to and someone who again gave me what the tools that I needed to cope. And like we discussed, that life continues, your child gets older and their demands I thought that newborn was a mess, but oof, this toddler stage is kicking my bum. But anyway. But anyway, again, the tools are helping a lot. Like after a hard day, I just sit in bed and I'm like, okay, what went well? And then I think also, I'm capable. I'm his mom for a reason. I am like he couldn't have a better mom than me. I have to like psych myself up. But then those are things that I learned so that you wake up in the morning and you do it again.
Yeah.
So I'm so
Beautiful. I love
grateful.
it.
Yeah, I'm really grateful.
I think for me, I had tried so many other different things before getting pregnant. So like I had hypnotherapy, I had CBT therapy, I had kind of like exposure therapy. There were so many other things I'd done to try and help myself before I got pregnant. And then it got to a point where I was just like, I'm just going to get pregnant and just see what happens kind of thing. And then so the difference between things not working and me not believing, like you were saying, Fari, you're like, oh, I don't, what's really going to do? How's it going to help? Like really honestly feeling that way of like, I'll do my best. And I've got this real people pleasing kind of personality where I want to be people's favorite. Why? I don't know. But, you try and be amenable and happy and nice. And you say, oh yeah, I'm trying. And yeah, that works. And you're like, doesn't really, but okay. This actually did. The therapy I had postnatally was EMDR. So it's like the eye movement sensitivity. And for me, like not reverting, but kind of looking back on past experiences and then maybe reimagining them or really going into detail about what happened. For me, there was a huge difference in how that affected me. So me before treatment and me after is actually a lot more hopeful because I have a bit more faith in treatments and a bit more faith in things that work. Whereas before I didn't. I kind of was very dismissive and I was like, oh, people don't know, people don't understand, like as if I was special. But which now I know I'm not. But that's what it helped me with, is that hope that actually something could work or something could make me feel better.
And I think that's a lovely place to end the podcast today. I want to say thank you ever so much to Fari and Susan for joining us. It's been great and I've really appreciated everyone being here today. So if you've been affected at all by what we've been talking about today, you can access support through your GP, health visitor, midwife, or call 111 who have a mental health dedicated line. You can also go to the Summon Health website and click on the Help in a Crisis link, which has a list of local support contacts. So thank you for listening to Conversations with Perinatal Psychology, talking about maternal mental health, because your mental health matters, both you and your kids.